This morning, our group will be presenting the cognitive learning strategy in nursing education. We will be presenting the topic about understanding heart failure. We will be giving you all the strategies on how to deal with the topic. So come on, join us.
What is cognitive learning strategy in nursing education? In nursing education, the cognitive learning theory prioritizes getting students actively involved rather than just listening to lectures. It uses discussions, realistic patient situations, and practice scenarios to make students really think about and understand the information. This method builds strong problem-solving abilities by giving students complex, incomplete cases that requires them to analyze data and come up with well-reasoned solutions, like they would in real hospitals. It also grows critical thinking by pushing students to ask why. Look at the different viewpoints and put information together to make a good clinical decision based on evidence-based practices. By focusing on these decisions, thinking skills, nursing programs can create graduates who can adapt, practice safely, keep learning throughout their careers, and always put their patient first in changing healthcare environment. Ultimately, this theory aims to produce nurses who are sharp thinkers, effective problem solvers, and constantly striving to improve patient care.
Parts of a case study. First, we have patient information. Second, we have chief complaint or the main problem. Third, we have the symptoms and observations. Fourth, the vital signs. Fifth, the diagnosis. And sixth, the treatment plan. And lastly but not the least, the nursing care and intervention. Moving on, we're going to the step-by-step guide on how we make a case study. So first, we have the patient info, name, age, gender. So second is symptoms. What is the patient's feeling? Example, if the patient is tired, short of breath, like that. Third, we have the vital signs. The blood pressure, the HR, the RR, the temp, and the O2 saturation. So the fourth is diagnosis. We will get the based on symptoms and tests. Fifth, we have the treatment, medicines, lifestyle changes, and therapy. And lastly, we have the nursing actions. That is what we will do as a nurse.
So today, we're going to discuss what is heart failure. Heart failure is a chronic medical condition in which the heart is unable to pump blood effectively to meet the body's needs for oxygen and nutrients. This can result from weakened or stiff heart muscles due to various underlying conditions such as coronary artery disease, high blood pressure, or previous heart attacks. As a result, blood may back up in the lungs or other parts of the body, causing symptoms like shortness of breath, fatigue, swelling in the legs and ankles, and reduced ability to exercise. Heart failure is a serious but manageable condition that often requires lifestyle changes, medication, and sometimes medical devices or surgery.
So, heart failure is a condition where the heart is unable to pump enough blood to meet the body's needs. It can be acute or chronic, and it affects the efficiency of heart's ability to circulate blood. So first is the signs. These are the observable indications that may suggest heart failure. First is swelling in legs, ankles, and feet, or it is called edema. Next is a rapid or irregular heartbeat. Enlarge the neck veins. So for symptoms, first is the shortness of breath, especially during activity or when lying down. Then fatigue or weakness, persistent coughing and wheezing, chest discomfort or tightness, and difficulty concentrating or confusion. Then for treatment, first is the medication, diuretics or ACE inhibitors, beta blockers, and others. Lifestyle changes for low salt diet, regular physical activity, quitting smoking and limiting alcohol. Then medical devices is for pacemaker or implantable defibrillator. So for the diagnosis, first is physical exam. It is checking for swelling heart sounds and breathing issues. Next is chest x-ray. It is to detect fluid in lungs or enlarged heart. Then electrocardiogram or ECG. It is to identify the heart rhythm problems. Then echocardiogram. It is to assess the heart structure and function. Then blood tests including BNP levels to check for heart stress. and stress test or cardiac MRI or CT scan for further evaluation. So for prevention, first is we need to control high blood pressure and diabetes and avoid smoking and excessive alcohol. Then maintain a healthy diet and weight exercise regularly, manage stress, follow up with regular health checkups.
Good morning everyone! So are you guys ready? Yes! So today we will be having a case study analysis. So here is the case. So this week, here's the case study of Mrs. Santos, a 65-years-old woman. She's been very tired and gets out of breath even after walking short distances. She has trouble breathing when lying flat and needs 2 pillows to sleep. She also noticed swelling in her feet and ankles recently. Please read the 3 questions. Identify the problems based on her symptoms and vital signs. Think about the nursing interventions she needs. Consider what actions should be taken to manage her heart failure and improve her condition. Okay, so I will now give you 5 minutes to come up with an answer and we'll get it later. Okay, time's up. For question number 1, identify the problems based on her symptoms and vital signs. Please answer Ms. TEJA.
So for number 1, she is very tired and short of breath, especially when lying down.
Okay, so very good. Okay, for question number 2, think about the nursing intervention she needs. Yes, Ms.
I would help her sit up to make breathing easier and monitor her oxygen levels.
Next, question number 3, consider what action should be taken to manage her heart failure and improve her condition. Okay, Ms. Garrido.
Hair care plan could include daily weight monitoring to track any changes in her edema. We also need to educate her about recognizing signs of worsening heart failure.
Okay, very good everyone.
Part of the activity that we are going to present is a group discussion discussing about heart failure.
So hello everyone, I am REXSELLE with DACER, and today I'm going to share my experience about heart failure with my father. So it started with fatigue, then shortness of breath, swelling in his legs, and a constant nighttime cough. My father was so strong, was suddenly struggling with everyday tasks. We thought it was just a drink until he collapsed and we rushed him to the hospital. That's when we heard the words congestive heart failure. So it was a shock. We had not recognized the signs, but through his diagnosis, we learned that heart failure is a grade 1 serious condition. The symptoms were there, we just didn't know how to read them. So since then, our family has changed. We've learned to prioritize health, to listen more closely, and to never ignore the little things. Little signs, rather. Most of all, we've learned